welcome to the Birth and Body Podcast. This is Kim Farr, and I'm happy you're tuning in today. I'm a student midwife with Bethany Stricker Midwifery. We serve families through the midwifery model of care by offering preconception counseling, prenatal care, and home and birth center birth. This podcast is all about women's stories and voices and meant to be an encouragement and resource for all things women's health and wellness. If you're enjoying the podcast, we would appreciate your support so that we can continue offering this resource to families everywhere. Please visit the Liberapay link below this video on YouTube or in the description wherever you are listening to the podcast. If you're a doula or childbirth educator and desire to further your education, or someday you want to be a midwife, I would love for you to join Bethany's Steps to Midwifery group, where we study cases and go into detail about all the things we talk about on the podcast. Visit Bethany's website at bethanystricker.com for more information or join the Steps to Midwifery group. Today we're turning the tables and we're hearing from Bethany Stricker about all remedies for the 4 trimesters of pregnancy, first, second, third, and the 12 weeks after birth. I'm so glad to have you here today, Bethany, and for us to have an opportunity to talk about complaints in pregnancy, common complaints, and those sometimes even start before the first trimester. So could you maybe talk a little bit about what's a complaint we hear early on about maybe not getting the birth people want, or what they can do to remedy that?
Yeah, I'm so excited you're here, Kim, that I can do the show with you because people love hearing from you too. So yeah, I think you're right. When they first come for their consult, often before they begin care with us, want to ask some questions, understand how things work. They do usually talk about their previous birth, and that's often leading them to seek out midwifery care and something different. So, I think most often they're not satisfied with how they're treated or had more interventions than they wanted. Mm-hmm. Often, not always, but maybe having an epidural or induction or C-section that they didn't want. So
right.
Often it's just starting with processing their birth.
Mm-hmm. Do you think people are surprised when you start giving them things to do?
I think you're right. Most people don't realize that they can work toward their birth. Mm-hmm. I think we're sort of taught that it just happens to you and, oh, this person had an easy birth and she got lucky or something.
Right. I hope I get one of those.
Right. And they don't realize there's birth is a process that it's the baby moving through the pelvis. You can make that a lot easier.
Right. So what are some things that people can do to hopefully have a better birth?
Well, I think it starts with people understanding what the process actually is. Often they're, going into the hospital and being put in the bed, and they just don't understand that's not helpful at all.
Right.
So I think just knowing ahead of time, if the baby can move well through the pelvis, it's a bone-on-bone type issue. So if you have the baby's head in a good position and the pelvis is freely moving, which usually means you're upright, not just laying down or on your back, and all the soft tissues, the muscles that are connecting all the bony parts of the pelvis together, if all of that's able to move and function well, the baby can, it's like a basketball through a basketball hoop, can move well. But if it's tight, that's going to be a lot harder. So being active in pregnancy, we want people to walk every day is really helpful, just for stamina, but also it helps your pelvic floor. It helps mobility. Right. We love chiropractic care because sometimes even if you're doing all of that, if your maybe sacrum is out on one side, your pelvis is going to be restricted on that other side. So things like that, making sure everything's aligned. And then I think a lot of people don't realize, the baby gets everything through the placenta, through pregnancy, and then during labor too.
So nutrition really matters.
Yes, and nutrition builds the baby and the placenta. So if we have a healthy placenta, usually heart tones are going to be great through labor. Certainly there's times where maybe the cord is wrapped around the neck and there's other factors that might make heart tones less than ideal that could lead to interventions for someone. But if we have baby that moves well through the pelvis and it's getting everything it needs through those contractions, you're likely to have a great birth where you don't need intervention. So it takes, 6-9 months of work to...
Right. But that's really empowering because people know they can contribute to the outcomes of their birth and it doesn't have to just happen to them. So as we move on to the first trimester, what are some common complaints that moms have during the first few weeks of pregnancy?
I think we hear most often fatigue and nausea. Yes. I think we hear those all the time. Sometimes vomiting too, but we hear those the most. Yes. If it's not one thing, it's another.
So good remedies for those things?
I think we tend to explain why do those happen. So your blood volume hasn't diluted yet in the first trimester, and yet you have so many hormones building that baby and making sure placenta's doing well and everything like that, sustaining the pregnancy. So usually just making sure you're drinking plenty of water. Often like adding lemon is really great because that helps your liver. Your liver's processing all those hormones. Some people, if they've had really bad nausea and vomiting in a previous pregnancy, I love to see them before pregnancy to do a liver cleanse because sometimes that helps significantly if you're just working on that before. Especially, I know we learned recently, like if you've been on oral contraceptives before, that is or any medication really, is really hard on your liver. So depending on your history, that might be really helpful to do before you get pregnant. But so it's just... staying hydrated, diluting those hormones is really helpful.
Sometimes headaches, too, can be thrown in there.
That's true. If you're struggling to keep stuff down and dehydrated, maybe.
Right.
So trying to stay hydrated. And if you can't, talking to your midwife or doctor about maybe you need an IV. And then I know we love like peppermint tea, ginger tea, those kinds of things that are calming to the stomach, really... kind of anti-nausea. Right. We love those ginger chews if you can't drink a ton.
And our go-to for fatigue.
We love bioplasma. Yeah, and I don't know if people listen to Clavelle's episode. She talked about homeopathy. She mentioned bioplasma a lot, and it's cell salts, diluted, I would say. So really important minerals that just absorb really easily. You can take it every 10 to 15 minutes, and it really helps support what your body needs to be building that baby, especially in the first trimester. Sure. And we like it too when we're tired.
Yes.
Tired midwives.
Okay, after birth, for sure. Yeah. So we're heading into the winter season. Another thing we sometimes hear, allergies, colds. What are some good pregnancy safe remedies for things like that?
Goodness. My go-to for allergies is Allermax by Country Life. It's basically anti-inflammatory, but you do have to take, consistently. If someone has allergies, and any natural thing, you're going to have to take it consistently to build up usually in your body and have the effect you want. So it's not going to be like Claritin or something like that, but it's safe in pregnancy, and a lot of people would rather do that instead of a medication. So if someone knows, I always have allergies a certain time of year, I would rather them just start taking it before it really becomes an issue. And I love the Highlands brand homeopathic allergy medicine too. I think it works pretty quickly, like every, whether it's from pollen or the cedars or whatever.
Sure. And cold and flu?
Goodness.
I'm picking your brain for all the things today.
I think, and I have a blog post about it on my blog. I think it's really important to support the body. Like, what are the things that are making you more likely to get sick? Because we already have our immune systems that are supposed to do it for us, but often we're doing things that dampen our immune system so that, that's how we're getting sick. It's not attacking those viruses and bacteria the way it's supposed to. So stress is the main one, especially this time of year. Sugar, compromises our immune system. I want to say a tablespoon like dampens our immune system for like 4 hours.
I've heard that too. Yeah.
And it also, just the process of taking in the sugar and what our body has to do to get rid of it uses up so many vitamins and minerals.
Right.
So if you're going to, do certain things this time of year, eating pumpkin pie and all this stuff, you need to take in more vitamins and minerals if you really want to support your immune system, which in pregnancy, so that your baby does, your body dampens the immune system to accept the baby because it's foreign DNA. Basically, it's not you. It recognizes it's not you. Right. So you're all that much more likely to get sick in pregnancy.
Right. Plus your body's working so hard to make a baby.
So you already need that much more vitamins and minerals. So I love bioplasma too. If you're stressed, tired, eating stuff you shouldn't, not drinking enough water, staying out late, all that, all these parties and things that we're going to. I love bioplasma. Certainly you can always do more vitamin C, more vitamin D in pregnancy. There's nothing wrong with that.
Right.
And then I don't think we have studies on elderberry, but there's nothing in elderberry, which is, if you don't know, it's a herb that has berries that are really antiviral and antibacterial. There's nothing in it that would cause contractions or harm to the baby. So the actions when we look at them are considered safe from what we know, safe in pregnancy, even though we don't have huge studies on all these women taking elderberry.
Plus we like echinacea.
Echinacea is great too.
Yeah.
People probably know it as like the purple cone flower that bloom in the spring. A lot of people plant them everywhere, but when you harvest, the botanical name is echinacea, they harvest the root, that part of the plant. Not some people use the flower and the leaves, but the root is a lot more like potent and has more antiviral properties.
And that's what they make the tincture out of, like herb pharma.
Yes. So they usually harvest it around this time of year because when it goes dormant, all of the properties go into the root. So that's the best time to harvest it. Fun fact.
Very smart.
Don't harvest it in the spring because all of the nutrients are going to the leaves.
Right.
So it is great and safe in pregnancy too. I love the tincture. If people aren't familiar with that, it's basically the root put in alcohol and then all the constituents come into the alcohol. So all the antiviral properties are in there. And it's great, especially if you think you might be getting strep throat. Because when you take it under the tongue, it's, going directly onto that area and kills it really well.
Oh, that's a great tip.
You can take it like every hour.
Okay, let's shift gears. How about urinary tract infections?
So for urinary tract infections, I think a lot of people think, oh, that's not going to happen to me, but they are much more common in pregnancy because of the hormones of pregnancy, especially progesterone. So we need progesterone to not have the uterus contract. It's like a muscle relaxer, right? That's how we stay pregnant for 9 months instead of getting a period again. If people are low in progesterone, sometimes they're more likely to miscarry. So that's why we check progesterone, all that kind of stuff. But because of that, the ureters, they relax too because of the progesterone.
Plus the pressure of all the baby.
Right. And sometimes that causes them to kink. So you can have fluid stasis in them. And that alone, if you had fluid stasis, just like, kids are more likely to get ear infections because of the way their tubes are. When they're young, you're more likely to get a UTI. Just even if you're eating perfect and drinking water, just from the high levels of progesterone, potentially the baby, pressing on your bladder, everything like that. So it's so much more, all the more important to drink plenty of water in pregnancy.
Go to the bathroom regularly.
Yeah, it's so hard for like teachers and things like that where they're not allowed to take breaks, and it's so important in pregnancy to keep UTIs at bay. So that's really important. But if someone is more likely to get them, things like vitamin C, we love cranberry. You can do juice, but I know it's really, really sour.
Yes.
Especially when it's the sugar-free cranberry juice, but you can do cranberry capsules, things like that. I also love D-mannose. It's a specific supplement that when you take it, especially if the UTI is caused by E. coli really likes to attach to the wall of the bladder. So D-mannose basically makes the wall of the bladder really slippery, so it can't stick in there. So when often, if people don't know, midwives run cultures and everything. So if someone's having signs of a UTI, or if we see blood in their urine or whatever's going on, we run a urine culture to see what is causing it. And that can better tell us what supplements should we recommend, especially if they want to avoid antibiotics. Often, if they just do antibiotics, it'll probably clear it up, hopefully, if you get the right kind.
But then you have another issue.
Right. Like, why was it there in the first place? Is it just going to come back? So some people, they have to do a really low sugar diet because often bad bacteria is it proliferates because you're feeding it potentially by sugar or whatever your diet is. So if you eliminate that, hopefully they'll die too.
Right. Okay. Moving on. Leg cramps.
Leg cramps common in the the second trimester.
Yes. Second trimester.
Yeah. It's especially if people are low on vitamins and minerals, you're more likely to get them. Just like if running a marathon and you're not taking care of yourself before and after, you're going to get leg cramps, right? So it takes a lot to grow a baby. So we love magnesium, I would say, especially before bed. If they're getting them like restless leg almost at night.
Oh, that's good. And we'll jump off magnesium to constipation.
We love magnesium for that too.
Yes.
But I think just like everything else, it's like, why is that a problem? Like, are you not
having enough fiber?
Right.
Drinking enough water.
Are you not walking? What's your lifestyle like? Certainly with a high progesterone state of pregnancy, it does slow down your GI tract too. Just like, it affects all your muscles, so it can affect your GI tract too. So sometimes it's just the way it is. But if you can take care of yourself, drink lots of water, lots of fiber, walk too.
And sometimes we hear people have the other problem.
Yeah.
What if people have diarrhea?
Well, I think you got to look at like why, like, are we having a virus or
and usually we tell people to wait 48 hours and see if it stops before you call us or before you take any medicine or anything like that. So I'll kind of figure out what the problem is.
Right. And because like we talked about, your immune system's a little dampened when you're pregnant, so you're more likely to maybe have symptoms from coming in contact with a virus when before you just didn't tend to do that.
So another second trimester thing that we hear a lot that we're concerned about is anemia.
That's true. Low iron. A lot of women are anemic in pregnancy. So we like to talk about, when you're starting at a normal hemoglobin or iron level in the first trimester, as you move along, your blood volume's expanding so that the baby gets everything it needs by the end of pregnancy. You need a lot of blood flow over the placenta, washes through that placental bed, goes through the umbilical cord, gives it to the baby. So it is normal to be slightly anemic. Your blood volume's expanding. That's a good sign. Sometimes we're actually concerned if it doesn't. If your blood volume's contracted, are you eating enough, things like that. So it is somewhat normal to drop a little bit, but we love iron-rich foods first. I know you have great lists of that you send to people. Spinach. And sometimes it's surprising what, iron-rich foods there are. Right. I think like legumes, and there's so many iron-rich
nuts
foods.
And seeds and green leafies and all those sorts of things.
Yeah. We love Nora tea for anemia too, because it has the nettles and alfalfa, which are super high in iron. And when you make the infusion and steep it overnight, it just absorbs so well.
Right.
So
that's really good.
But there's supplements too, like Hemoplex and
Floridix and chlorophyll and
food sources of iron.
That's true.
And some people, like we were talking to a friend the other day, some people don't have iron deficiency anemia. So some people need B vitamins or different things to help their body increase their hemoglobin. So it just depends what kind they've got going on.
Right.
Which your midwife, can look at your labs and tell you about.
Right. Okay, here's another one. As pregnancy progresses, sometimes people have pubic pain or pelvic pain, or what are some things they can do to, make that better, feel better?
Yeah, that's a good point. Just as the baby grows, your ligaments are having to stretch and your back and everything has to compensate. So pain, I would say, and back pain in pregnancy is pretty common, but...
And a lot of times around 22 weeks, some of that all
just
comes
starts,
out. And it's like, okay, what has changed? Why does this not feel the same?
Right. And it is common, but that doesn't mean it's normal. So
Right.
Pregnancy really should not be painful. Usually it means either you have, maybe your sacrum is out, or your ligaments aren't stretching the way they should be, or something is tight, making something else loose.
Right.
So we love sending people to a chiropractor that does a lot of body work and soft tissue work to fix whatever's going on.
Right.
And
Recommend yoga, kind of keeping your knees together so you're not pulling things apart and getting your pelvis all kind of wonky when you're...
You do have to just be aware too. You know, pregnancy is different, so sometimes you have to modify your activities. But
Right.
yeah. And sometimes using like a belly band is helpful to keep that pubic bone in the front together.
Right.
Some people just with the relaxin hormones that, you know, allow your ligaments and pelvis to move apart a little bit for the birth, that joint just starts to move. So using a belly band can be helpful too.
Right. Okay, let's keep moving. How about third trimester insomnia?
Oh, it's hard when you can't sleep at night.
Yeah.
I like magnesium for that too, because it's
Yeah,
really
it is a
calming
good
to
thing.
the brain, and you can take it at night, you know, before bed. I really am liking Amy Meyer's NeuroCalm. I think I told you about that a couple weeks ago. It just has a few different kinds of magnesium in it.
Right.
And I feel, of course, I love the Calm, you know, brand of magnesium powder too.
Right.
But I really like the NeuroCalm lately.
Good sleep hygiene, good
Right.
routines before bed.
You're right. Not being on your phone with all of those blue lights, and not doing things that are going to stress you out before bed too.
Yes.
Like, don't work and you know, hopefully you don't have to. Hopefully you can structure your day so you can wind down at the end of the day versus
Right.
ramping up and like checking your emails and all this
Drinking
stuff.
chamomile tea, putting on aromatherapy,
chamomile tea is
different
great.
things like that.
Take an Epsom salt bath.
Right.
Epsom salt's really high in magnesium and it's really calming.
Right.
So,
That's good.
yeah. And like making sure you're comfortable trying to go to sleep too. Like get a pregnancy pillow or something.
Right.
Stretch before bed. Do pelvic rocks. If your back's hurting, like try to work that out before you get in bed. It's hard when you're restless.
Those are good things. How about swelling? Some people
Yeah.
find swollen ankles and hands and things.
Yeah, just with the increased blood volume of pregnancy, and you're more likely to have some water weight in pregnancy, especially at the end. And I think a lot of people are concerned about it because it can be a sign of preeclampsia at the end, which is a hypertensive and sort of liver disorder of pregnancy. So if your liver's not working well, you're more likely to have that edema with it. So I know people are freaked, but if you're sitting for a long time, or maybe you're standing any really position for a long time, you could have some swelling, especially in your ankles, because of you're just not having that blood flow back up as easily. So like our clients that are waitresses, or maybe they're on their feet all the time, or office
Sitting
job,
at a
they're sitting
desk.
all the time.
Yes.
They both tend to have that. So sometimes just putting your feet up and changing activity, you know, what you're doing, walk around for 5 minutes every hour can really help. Some people have to do the compression, you know, socks. It's not very comfortable, but that can be helpful. And then also just looking at their diet often. They might notice, you know, I went to Chick-fil-A and then I had swelling because of all the salt or the fast food. Their liver's having a hard time processing all of that. So sometimes eliminating that factor is helpful. Or I love milk thistle too. That tincture, it really supports the liver and just gently detoxes it. So if, you know, with the position changes and things like that, if we're still having an issue, it can be really helpful to get that going again. So it's often multifaceted what people need to do to help the sweating. And, you know, in the summer here in Texas, like it's normal when you're on a walk for your hands to swell a little bit. So it just depends. But we usually say if you have swelling, especially when in your face, when you wake up in the morning, that's not really normal.
Right.
You should definitely let your midwife care provider know about that. So.
Yeah. Some women find in the 3rd trimester, we test for GBS and they find, oh, okay, I tested positive. What do I do for that? Does that mean I have to have antibiotics?
That's a good question. We could do a whole podcast on that, Kim.
Sounds so fun.
It is an interesting topic. With GBS, so group beta strep, everyone has it in their gut. Like, we have all kinds of organisms in our microbiome, but some people are over-colonized with it. So they have too much. So then when they do the vaginal swab at 36 weeks, it tells us if they're positive or negative, which really just means if they're over-colonized or not. The thing about it is if they are over-colonized and you have, vaginal birth, baby comes through that, a certain number of those babies that are born to positive mothers are going to experience a respiratory infection from GBS.
Yes. And it's a small amount, probably 2%, I think.
It's very rare, and depending on the strain, which they're starting to research, some strains are just more aggressive than others.
Right.
Some babies have died from those infections.
Right.
So
it doesn't feel like a small percentage if it's your baby that's sick.
Right. So that's why here in the U.S., everyone is offered testing. And then if they're positive, they can decide what they want to do for that. So usually it's ampicillin or clindamycin that's given in labor if the parents choose it. But again, it's different for everyone what risk they want to take on. Like it's, some people feel like the risk of antibiotics is really great. And some people feel like the risk of having a GBS positive baby and not doing antibiotics is really great. So it just depends. But I prefer to try to get everyone on probiotics at the beginning of pregnancy with their prenatal vitamin because a lot of studies show that women who take probiotics, especially with L. rhamnosus, that strain, are much less likely to be GBS positive.
Right.
So,
and then you don't even have to make the choice.
Right. If you have a good balanced gut flora, which probiotics help with, whether you're going to maybe take a supplement or fermented foods, whatever you want to do, you're much less likely to have that issue.
Right.
So it's nice to think on the front end about it.
Sure. It is. Okay, another one we hear as pregnancy progresses and someone is 39 weeks and 5 days. Okay, I'm getting close. Okay, now I'm 40. Now I'm 40 and a half. What do I do about this? What's going to happen to me? Because I'm so far along. How long will you let me go?
Sure.
What can you do to help me have this baby?
Well, it's normal for a first-time mom to go to 40 and 5. That's super average. So some women will go before that, but there's many women that'll go past. So I think just knowing ahead of time, this is normal for me to go past my due date helps a lot. Because that means a certain number of women are going to go closer to 42.
Right.
And I think our society says that's not really normal or just go and get induced. But a lot of our clients know there's risk to that. It's not something they actually want to do.
Even if it's a natural, quote unquote, natural induction.
True. There's risk to everything.
Right.
Anything can be an intervention. So.
And there are consequences.
Yeah. So I think, what can someone do? Like a lot of people don't fully know that if the baby's coming down on the cervix and putting pressure on the cervix, there's receptors there, right? Which send messages to the brain. Oh, like maybe it's time for things to get going. And then the body produces oxytocin, which causes contractions, and that pushes the baby down on the cervix more. And that sort of cycle just keeps happening. And then it, you end up pushing over the edge, you go into labor, have a baby. So sometimes it can be where they're going so far overdue, it's because the baby's not down on the cervix. Right. So sometimes it's doing spinning babies things and belly lifts and walking, and if they have a pendulous abdomen, so they don't have that, quite muscle tone. So baby is just hanging out there on the pubic bone.
Right.
We recently had someone in this situation. So they need to have their belly bound or do kinesio tape or do belly lifts with the contractions, and that can get the baby down in, and then it's just going to happen. So it is also figuring out, why are you going overdue? Is this just normal? Is it, some women have like thyroid conditions where they're just really low on hormones. So taking some supplements that would help that would be helpful, and they'll just start producing their own hormones. So it just depends. But most of the time it's just normal to go past due, and maybe telling family what your due month is and not your due date, so they don't bother
That's a great
you
idea.
ahead of time. Because it's hard if you feel pressure from everybody.
That's true.
Especially if you don't have, if you're choosing an alternative way to have a baby and then everyone's pressuring you, it's just helpful to...
Right, and a little skeptical. Is this really going to work? Should you be doing this?
Yeah, and you just need positive around you. So
yeah, that's true. Okay, a lot of times after people have the baby, they think, okay, it's done. But there's actually a lot that goes in the 12 weeks after a baby.
Yeah.
And so... I guess I could throw some complaints at you, or you could think of some, but sometimes moms have some kind of depression or baby blues after. What are some good things that they can do to kind of feel better?
Sure. Well, so once the placenta comes out, that was producing so many hormones, and you're going to have a huge drop consequently because of that. So I think having expectations of it's normal. And then when your milk comes in, you're having hormone reduction and then hormone production. Like, it's just all over the place. So I think having that expectation and grace for yourself, this may be hard for the first few weeks.
Especially if you have other kids and you feel like, oh, these people need to be on a schedule and I still have to feed and do laundry and blah, blah, blah.
Right. And it's just a whole new transition, and you're adding this whole other person to your family, and it's a lot. So giving yourself grace and not expecting yourself to do much besides rest and take a shower and go to the bathroom and feed your baby. And that's pretty much all you should be doing the first couple of weeks. So with that said, it's normal to be somewhat teary and cry at whatever, or it seems like you're crying at nothing the first 2 weeks. That would be considered like baby blues in the first 2 weeks. But if someone is feeling that way past that point, anytime in the first year, it would be considered postpartum depression.
Okay.
So if you just certainly, you're sleep deprived as a new mom.
Yes.
You're feeding your baby every 2 to 3 hours. So fatigue is a huge factor in feeling postpartum depression. Just like any depression, if you're tired, you're more likely to experience that. But if you're not enjoying, similar to other depression outside of postpartum, you're not enjoying what you used to enjoy. You're maybe not, you don't feel like you're enjoying your baby. You don't feel like you're doing well at anything. Feel like a failure, not, laughing or being happy at the things you used to enjoy, all those kinds of things. There's many other symptoms too. That would definitely be something to talk to your partner or doula, your midwife care provider about, to make a plan, like what's going to be helpful. There are supplements and things like that, I think, that are helpful, but I think we've found that often it may be, not always, but sometimes it's lack of support and her having to take care of, the whole house and do everything she used to do and all the kids and breastfeed her baby. And it's so much, and she's so exhausted that it's often leading to feeling those feelings.
Plus feeling like you need to connect and communicate with your partner still. And
especially, if it's after 6 weeks and you feel all this pressure to be whatever his expectations are, it's really hard. And just, so sometimes it's making a plan of, maybe I need a mother's helper, or my partner's going to also get up in the night for this long and until I feel better. Or sometimes it is supplements, or sometimes being anemic, low iron can contribute to postpartum depression. So, or thyroid things. So if your thyroid feels off, so checking all those, it's multifaceted. It might be supplements and a change at home.
Vitamin D and being in the sunshine a little bit.
Lab work and maybe postpartum doula and all the things. And just in realizing it's not forever too.
Right.
We also had there's some new research that low progesterone often leads to postpartum depression from the NAPRO Technology Institute. Right. So if I have someone on it in pregnancy, I'm often more aware postpartum. If they're already low in a state where they shouldn't have been low, that's something to keep in mind too.
Right.
Sometimes taking progesterone really helps. So,
how about after pains, especially moms who've had multiple babies will have after pains after, and sometimes they hear about it from other people and they're a little fearful.
Sure.
What are things they can do so that they don't knowing they don't have to be afraid, and there are some things that they can do to make themselves feel better?
Yeah. So after pains, often first-time moms don't experience them at all. So once baby comes out, placenta comes out, and then the uterus that used to be the size of a watermelon, that's usually what it's compared it to, it has to contract down. So by 6 weeks postpartum, it's the size more of a pear. It's in your pelvis. It's not palpable from the outside. It's a protected organ in your pelvis for a reason. So we want it to be safe in there. So that process of going, contracting back down, obviously it takes time, but the more babies you have, usually the more you feel that contraction. So some people call it after pains or after contractions. It feels kind of like an old term to call them after pains, but
it does.
That's what we need a new name for that. But so if you think about, it's a muscle having to contract. If it's a normal function and it's painful, in my mind, I think a lot of midwives feel like it needs something. So often after a long labor or whatever it is, it's often maybe lactic acid buildup or what's causing it to be painful. So I usually recommend like calcium, magnesium, or liquid calcium after to give that muscle what it needs to continue to contract down and not be painful. That's my go-to. I find it really helpful, especially if someone has had a lot of babies. Usually when they've had 4 or 5 or more, sometimes women say it's worse than their labor contractions and they're really concerned about it, especially when they go to feed the baby. Usually that causes more contractions, which God made it that way on purpose. We want every time to feed the baby it to contract down so that the placental site doesn't keep bleeding. Like it's a great design, but sometimes it's so bad they don't want to feed the baby because they know it's going to be so painful. So usually I recommend taking, your calcium, arnica. Homeopathic arnica is really great for pain too.
Okay.
There's a bunch of different homeopathics that are great for after pain. So even depending on your constitution, you should probably talk to a homeopath. We should have Clavel back just to talk about that. But after ease, that's a tincture that a lot of women like too. I usually don't recommend that until several hours postpartum because it works by allowing the uterus to relax a little bit. So that contraction, it's going to relax that a little bit so it's not as painful. So whereas the calcium is, helping to give it what it needs to function well, the after pain tincture is going to allow it to relax, which it works well. But if you think about, it's contracting down to clot off and that placental site. So if you start taking it or take too much, you might bleed more. So that's also kind of stopping. We want you to have contractions, they're there for a reason, but we want you to be comfortable too. So I like the calcium, magnesium first, and then starting, taking that, your after pain tincture, your homeopathic. Certainly people can do Tylenol too, but I know a lot of our clients want the more natural options first. So if they can, they might try those things, and then emptying your bladder, because if it's a full bladder, the uterus can't contract down quite as well when that's in the way, and then sitting down and nursing the baby. So hopefully those supplements have taken time to work. Your bladder's empty. hopefully it won't be as uncomfortable. So it's you have to plan a little bit, especially when I use the natural things. So
thanks so much for sharing all of your remedies for all 4 trimesters and even a little bit before. It's nice to hear from you a little bit.
Thanks, Kim.
Nice to turn the tables. I have one more question for you.
Okay.
All right. So I guess all through 2020, we've heard it has been a bit of struggle for moms. They don't get to share their pregnancies as much. They haven't had baby showers in person. And so maybe how about some end of year ways to cope with all the things that we've all been through this year and how to gear up for 2021?
That's a good point. I think that in our society, we often celebrate in certain ways. And so it's been really hard to not have the baby showers and different things. And where moms don't feel as celebrated, they often feel more isolated at home.
Right.
So, and I recently saw like a headline about, who at your holiday party has COVID and you don't know it.
And they're saying don't go to Thanksgiving with
so
friends.
That's, I know, is really hard on moms too, when maybe their family members or, don't necessarily agree on masking or not masking and all this stuff. So I think it's important to find ways to celebrate maybe that are new or different. Like, I don't know if it means going, I celebrate not by eating. I think that's important. Like, that's a whole other thing. Often we as midwives, we're always celebrating with the families. So we would always be eating all this stuff that we should not be eating. So I try to celebrate by like going to like the lake.
Yes.
That's always what, that's enjoyable to me. I get outside. Hopefully, a lot of people could probably do that. People are okay with being outside, even with people, but just celebrating in a new way, making new traditions. And it's okay to grieve maybe traditions that you don't get to do. Like, it's okay to be sad and happy at the same time. That's really normal too.
Right.
So it's just a different year. Yeah.
Well, thanks for pouring into me and pouring into lots of families.
Thanks for interviewing me.
We love you.
It was fun being on the other side. I would rather do this. It's hard interviewing people.
You do a great job.
Kim.
Yeah.
Hey friends, thanks for tuning into season 1. After the Christmas break, we'll be back with season 2. For now, please go back, listen to any episodes you missed, and tune in for more fun next year.